Hey guys, I just got back from Las Vegas where I gave some lectures last week. Really learned a lot, and I had an expression I learned that it's pretty provocative, and I apologize if you deem it offensive, but I think it's actually incredibly good in terms of its explanatory power. So, as you see in the title, is that the neck is like a pregnant woman wearing Spanx. What does that mean exactly? Well, first of all, I do encourage you, before I forget, to look at my video where I talk about the neck is like a box of chocolates, and that's a good companion piece to this, although it's talking about a separate topic. So what this basically means is the fact that we today in our culture are really focused on minimally invasive things that don't require surgery to address. You have a gobbly neck, and all you really want to do is put some liposuction, or you want to do some kybella, and it just doesn't work. And the reason why is that all of that subcutaneous fat, that's the fat external to what's called the platysma muscle, that's suctionable and kybellable and cool sculptingable, are really not treatable, because that's not where the problem is. The problem sits internal to the platysma muscle. The platysma muscle, if you don't understand that, is the two vertical bands when you look at an older neck. And when you take that precious fat on the outside, it makes facelifts harder. It reduces the precious commodity that sits external to the muscle, and it doesn't really work well. So what's inside there is what I talk a little bit more in detail about in that other video I mentioned. But what usually it is a combination of digastric muscle, submandibular gland, and deep fat. These things are not really compressible. So when you do a facelift and you try to pull up on that deep tissue that's heavy and full, you can't compress it, and that's why you really can't get a great result when these are very bulky. A small submandibular gland excess, a small degree of fullness there, a deep plane lift that's really well suspended can already achieve some good results with it. But the heavier, the bulkier it is, the harder it is. So why use this analogy of the pregnant woman? Because it really does explain this quite well. So let me explain two types of bodies. Let's say one is just someone overweight, someone that has a lot of fat. Well, fat is compressible. So if you put Spanx on someone with a lot of fat, that tissue it's not as ideal. You want to reduce it still, but let's say you couldn't. But the Spanx can squeeze that soft fat in and create a good result. But if the problem is actually firm, which is in the case of someone pregnant, then you think about the fact that they've got firm tissues, they've got a baby, they've got fluid, they've got an enlarged uterus, they've got firm tissues that are expanded. You can't push that in, and that is why, if you think about it, you try to pull back on that tissue, you're just not going to get a great result on it. And so that's the analogy. If you think of a first trimester versus third trimester, if it's just a little bit and it's firm, you'll get a little bit of pushback, but not much. So this is why the neck, in my opinion, is very similar to a pregnant woman trying to put Spanx on it. And that's what that means is a conventional lift simply will not address that level of fullness in the neck with any discernible improvement. And so what I do is very unique. I encourage you to, if you want to know the safety of what I do, to look at part 3 of, I think, of my 5-part facelift series. It's on my website, lambfacialplastics.com, under facelift. Almost every subsection has those 5 parts, including the part 3. I encourage you to watch it also on YouTube if you don't want to go to my website, but that will help you understand the safety, the efficacy, what does it involve, why did you not go through that? A lot of my patients and my people that watch my channel have already seen that video, so there's no reason for me to recap all of that. So hopefully this video helped you out.